This is a success story about a journey to process management. Studies show that medical errors in the US hospitals each year kill 250,000 patients and harm millions, with an estimated increase of 20% in healthcare costs. Isn't it ironic that the very system designed to save lives is the third biggest cause of human death? Experts would agree that the problem is not lack of knowledge or skills, nor reckless behavior of healthcare workers. The problem is the organizational structure of the health system. There are two fundamental problems. Number one, hospitals are departmentalized. Different members of the same multidisciplinary team are managed by independent heads of departments. And the second problem is that the hospitals are compartmentalized. Different diagnostic and treatment units are managed as independent islands without aligning them and integrating them into a system. The focus is the knowledge of unidisciplinary groups without focusing on how collectively, safely, and effectively such knowledge is used in patient care. Decisions are made by heads of certain members of the multidisciplinary team without understanding how such decisions will affect other members of the same team. Internal communication is often limited to people of the same department, and team working is not a systemic requirement in the existing organizational structure. To improve the organizational structure of the health system, we looked at our own body. Although we are made up of specialized tissues such as bones, muscles, blood vessels, nerves, and so on, we are really structured into functional process units such as respiratory process, circulatory process, and so on. These processes are aligned and integrated into a system. Similarly, we transform the departmental structure of the organization into functional process units, aligned them, and integrated them into a system. The comprehensive unit-based process methodology, shortly known as CUP methodology, eliminated in part the problem of departmentalization and compartmentalization. Physicians and nurses were integrated into a team and they were managed as a team. Multidisciplinary communication and teamwork were part of the systemic requirement. The multidisciplinary teams were empowered and were responsible for monitoring and improving the results of their own clinical activity, such as safety, treatment effectiveness, and timeliness. Thus, the multidisciplinary teams became a part of the decision-making structure of the organization.